Hi everyone, my name is Noel. I'm 27 years old and I have thyroid cancer. The beginning of my journey started in July, towards the last weekend of the month. Started having breathing issues, and later that week we ended up taking me to the hospital to see what was going on. They ran blood tests, did an x-ray on my chest to see if there was any lung issues. Pretty much everything they did came out being okay. They claimed that they did blood tests on my thyroid, but they ended up just telling me go to my family doctor and getting ultrasound done on my neck, since at the hospital I found a lump, an actual lump that I could feel in my neck, right about where my scar is currently. We did an ultrasound and we found out I had 4 nodules, 3 on the right side measuring 5 millimeters, 7 millimeters, and 9 millimeters. Then there was one on the left side of my thyroid that was 2.5 centimeters. Also, the left side was mildly enlarged. So my family doctor instructed me to find an ENT in the area and go get them to check out what's going on. I advise everyone that has to search for an ENT to search up their credentials. How many surgeries do they normally do? Everyone's reviews on them. Because a year ago, I went to an ENT with a different issue, and pretty much every question I had, he told me, don't worry about it. Nothing's wrong with you. He didn't x-ray or ultrasound my neck. Because he didn't feel anything, there was nothing wrong with me. Now, that was a different issue. That was actually a abscess right underneath my chin. With my new ENT, we're going to look into that soon, but right now we're more concerned with the cancer. I went to see Dr. Casper at UC Hospital, and he went through my family history. There's no thyroid cancer. There's Hashimoto's, I will say that. There is Hashimoto's in my mom's side of the family with my aunt. So far, she's the only one that we found that has it, but it's still in the family. Right away, he didn't think I had cancer, but because the nodule was over 10 millimeters, which by standard they are supposed to do a fine needle biopsy on, he had to do it. He pretty much stabbed me in the neck about 4 times. The last 2 were a little bit more painful because grabbing tissue out, checking the full size of it, seeing how deep is the make of it. And they ran tests on it. The problem was the time that this happened was Labor Day weekend, and on top of that there was a conference in Washington DC, so all the testing got pushed back. So I didn't find out until 2 weeks later that I had thyroid cancer. And again, this doctor did not think I had cancer. We went in on, September 17th is when I found out I had cancer. And at the time I was already doing research on all my symptoms: difficulty breathing, difficulty swallowing. Now, the swallowing issue I've had most of my life, but it's gotten worse over the couple of years, to the point I can't even swallow liquids without choking. I was getting weakness in my legs mainly, in my arms too, but not as much. I had memory issues. I'm having problems with even spelling the simplest words. Concentration is really bad. I probably already mentioned memory. Again, memory. And all this is happening so fast. So, my doctor scheduled my surgery on October 2nd. Later we had to change it because someone else needed a surgery that was going to take them 12 hours. 12 hours. Same disease. They were far worse than me. And of course, my thing is, why should I stop someone else from getting their treatment? And it was the only time block that they had that they could change. So, since my parents already bought the tickets at that time, they just pushed my date back 1 day. So it wasn't that bad. My surgery took about 3 hours. Everything came out fine. Well, I have cancer, but the they didn't cut my vocal cords. They didn't nick any other glands in the area. They took some nodules out that were possible. Lymph nodes, sorry. Lymph nodes out that were possibly infected. Right now we're at the point of testing my blood every 6 weeks to get my medication adjusted properly. Also that to see if I still have cancer. The surgery doesn't cure all of it for everyone. Sometimes people are lucky that the cancer is just in the gland itself. But sometimes people either find out too late or spreads a little bit faster, to the point that it gets into the lymph nodes. And once it gets into the lymph nodes, it's a little bit easier for it to spread further. But thyroid cancer, out of all the cancers, is a very, very slow spreading cancer, which is good, but no cancer is good. You still feel like crap, pretty much. Sorry for my language, but that's how you feel. Currently, I have no energy. I'm sleeping more hours than I used to. I'm waking up at like 5, 7 p.m. at night, wasting most of the day away. I become a little bit more active at night though, which is kind of strange, but I still feel groggy. Memory's still horrible. Pain in my legs mainly. Now, I don't know if that's fully from this. We don't know yet. I don't see an endocrinologist until the beginning of next year, who will get the idea of, or give me the answer if I need to have radioactive iodine treatment. Now that's something different that none of the other cancers I know of do. There's no chemo for thyroid cancer patients. It's mainly this pill that, from my understanding, is the pill that you take, and it only attacks thyroid cancer cells. It can cause, from my understanding from what my auntie said, it can cause cotton mouth, like your throat's always going to be constantly dry. Other than that, I'm not sure what else, but I'm pretty much borderline on getting radioactive iodine treatment. My doctor pretty much said he wouldn't recommend it for me if I don't really need it. It would help treat me better in the future, but if that's all you're going to base it off of, he wouldn't do it, which I really don't want to do it. It's really hard in my living situation. We have a very small house, and afterwards, from my understanding, is you're supposed to have a separate bathroom from everyone else after the treatment, because you're pretty much radioactive and no one can use that bathroom. Well, sadly, we can't really do that in our small little house, so I'm hoping the endocrinologist will say, you don't need it. It'll be easier on my life, more so than right now. So that's pretty much how my life's been. With cancer, I'm still very new with it. I mean, yes, I had my treatment, I had my surgery, but again, not out of the woods. The problem with also the thyroid cancer, from reading up online, I have a 30% higher risk than the general populace of getting different cancers, including breast cancer, skin cancer, and lymphoma, which is all in my family. Well, my aunt has a weird kind of breast cancer. It's very rare, so I'm not sure if that's one that can be spread on. But lymphoma and skin cancer can be. Luckily, with skin cancer, it's a little bit easier to treat, especially the kind that my grandmother had. Lymphoma, I don't know what kind she had, so I don't know much about that one. Right now, because of having cancer, I have not been able to work for close to 2.5 months now, and struggling with money, and with currently only being able to work 2 days a week between now and whenever, if anyone would be willing to donate or at least spread my fund links around, that would be very much appreciated. Thank you so much if anyone does. It does really mean a lot to me, as being 27 years old and struggling with cancer so early on with life. Yes, there are kids that deal with it too. And that breaks my heart when I hear little kids dealing with the cancer. Being someone that has to deal with it at 27 and hearing others that are dealing with it around my age, it makes me sad, because you don't think of cancer being something for someone in their mid-20s or late 20s. Usually people will think of cancer at an older age. So to have this kind of like sprung up on you, which pretty much is what happened to me within a matter of 2 to 3 months time. So, well, I guess this springs up on everyone. But I'm rambling now. That's what happens with my medication. So I'm going to stop this video for now. Again, thank you for listening. Thank you to the friends and family that have donated to me already. Thank you to anyone else that donate to me, or at least share the link. Thank you for everyone that's helped me so far. Also, I would like to thank my fiance, who's helping record this, for being there for me through the hard times, as these medications do make you very emotional, like right now. So, thank you everyone, and I love my family and friends. Bye bye.